But what happens is when you get into negative thoughts, is that we just keep playing those negative thoughts over and over, ruminating, and it's a negative habit that we do, and that's a lot of people just spiral round and round, just going over and over these thoughts, and it makes their depression worse. Well, by creating new networks and new connections, we can get rid of those dangerous thought patterns and help people rethink the traumas that they went through. And so you see from just 1 or 2 doses in a large number of academic studies that patients can be completely free from depression or addiction for 5 or 6 months at a time, potentially, from just 1 or 2 doses. So this is a rapid effect, happens with pretty much the same day, and can last for 5 or 6 months. And the current treatments just don't do that.
This is the Alden Report.
Today's episode is brought to you in part by Wicked Happy. The way you live your life depends on your outlook, and theirs is simple. Be wicked happy. Wicked Happy provides you with apparel to make you smile. So if you want to be wicked happy and you want to look wicked cool, then visit wickedhappy.com, and at checkout, enter in the code RADIO for an additional 15% off your entire order. Again, visit wickedhappy.com, apparel to make you smile.
This is the Alden Report.
All right. Well, my name is Mike Alden. We are here in Blue Vase Studios. Of course, I'm still rocking my, I say 99-cent glasses, but with inflation now, they're actually $1.25 because I had to buy some extra ones. I'm rocking my Wicked Happy gear. I got a new kind of fresh Wicked Happy hat. You might want to know what that thing is. We'll talk about that later. This isn't about me. My next guest is the CEO of a company called Cybin. We're going to be talking about psychedelics. We talk about psychedelics. We want to talk about Tony Robbins and psychedelics. Like where's the connection there? We might even talk a little bit about Deepak Chopra and some other really influential people as it relates to psychedelics. Now, if you've listened to any of the stuff that I've done before, I've always been super interested in the brain, how we can be happier, how we can be more productive, how we can be less anxious. My next guest, Doug Drysdale, has over 30 years within the pharmaceutical industry, and he's the CEO of a company called Cybin that is making waves, the first publicly traded company in the United States with motherfucker. Screw that one up. We'll start over. All right. My name is Mike Alden. We are here in Blue Vase Studios. I got the fresh background still. We're still working on the color a little bit. I got my 99-cent glasses. They're really like $1.25 now. I'm rocking my Wicked Happy gear. And I'll tell you, I'm super excited for my next guest, as I'm always excited for my guest. But my next guest is the CEO of a company that's really kind of leading the way within the world of psychedelics. They're the first publicly traded company on the New York Stock Exchange that deals in psychedelics and how they can help us, with anxiety, how they can help us with depression. And it's really, really interesting what he's doing. He has over 30 years experience within this space, and it's really, really interesting what's going on. If you're not paying attention to the world of psychedelics, I think you will after. And by the way, we're also gonna talk a little bit about how there's a connection with Tony Robbins and psychedelics, and maybe some other guys like Deepak Chopra. Please help me welcome Doug Drysdale. Doug, thanks so much for being my guest.
Hey, Mike. Thanks for having me on today.
So, man, it's really interesting, what you're doing. Let me just first start out and say, I've always been an anti-drug guy. I've never smoked a cigarette. I've never dropped acid. And when you hear psychedelics, the first thing that comes to my mind, and a lot of magic mushrooms, acid, and you always hear like these horrible stories. But now, I mean, if people are paying attention to the medical community, especially a couple states here in the United States, it's starting to obviously become on the forefront of kind of combating mental illness and things like that. First off, tell me I know you've been in the pharma space for 30 years, but how did Cybin happen? How did you get involved in this space?
Yeah, so 30 years in pharmaceuticals, and a lot of that time I spent at companies that were focused on CNS or central nervous system drugs. So a bit of background in this. I've had several friends, family members that have struggled with depression, addiction. My mom died of lung cancer. But really it was her her addiction to nicotine that killed her. Not necessarily the cancer did it in the end, but she couldn't get off those cigarettes. So I think we all have someone or several people in our lives that are impacted by some kind of mental health disorder, whether it's depression or addiction or anxiety disorders. Anxiety disorders collectively make up 12% of the population. 12% of the population suffering from some form of anxiety disorder. About 80% of those are depressed, and we've just seen it get worse during the pandemic. So when Cybin came along,
I'm going to cut you off, but those people, and here's the interesting. By the way, I've talked openly about. I'm a lawyer by trade, and if you don't have anxiety in law school, then you're probably you're doing something wrong. But I've talked about I had a massive panic attack years ago. I talked about it in my first book, Ask More, Get More, and what I've done for it. And but the interesting thing that the stats that you're talking about is most of those people, right? I think it's accurate. One, they go undiagnosed and they self-medicate, right?
Yeah, I mean, look at tobacco and look at cannabis for a lot of people. Look at alcohol. People are self-medicating all the time. And, for psychedelics like psilocybin, which comes from mushrooms originally in its natural form, it's been shown that psilocybin is 10 times more safe than alcohol. So there's a lot of misinformation around these molecules that's gone on for years because of the war on drugs.
Yeah, because all right, let's do this. If you could educate me, what's the difference between LSD and psilocybin? Because I almost think that they're same when I think of like psychedelics. I know that usually if you're taking what people call like magic mushrooms, is there a difference there? Is one not quote natural versus one that's synthetic? Or
yeah, that's right. So LSD was synthesized in the lab 1950s or so. And psilocybin is now synthesized, of course, synthetically. We don't take it from mushrooms. We make versions of that synthetically. They're clinically very similar, but they vary in their length of session. So a psilocybin experience might be 4 to 6 hours. An LSD session might be 8 to 10 hours. So as we're developing these treatments to be used as mental health treatments, we're trying to make them much shorter than that, because you don't really want to be in a clinical setting for 4 hours or 6 hours. That's just not very practical.
Yeah, that makes a lot of sense. When I think also, I think of ayahuasca, I hear all these, people, there's so many people that are out there looking for answers, and I know that, we'll talk a little bit about how Tony Robbins is actually an investor in your company. He mentions it in one of his books. I think it's called Life Force. When I think about the people struggling in the United States, I lost a brother to an overdose. I lost a stepmother to an overdose. Both of my grandparents were alcoholics. My mother's HIV positive. My stepfather died of AIDS from heroin. One of my other brothers, was in rehab for a long time. And because they were just trying to find answers to their own mental health. And it's interesting. So you started this company in 2019. I guess really kind of my main question is, when you think about, even with cannabis right now, right? So when you think about what you're doing, you're really in the forefront and somewhat of a pioneer. Your company is somewhat, kind of paving the way for the space. Has it been difficult to get to, human clinical trials, or are you not there yet? Has it been difficult because of the ingredient that we're talking about?
There's lots of challenges. These molecules are scheduled by DEA in the US and by similar agencies in the UK and Europe and in Canada. So you have to jump through a lot of hoops. And to come to a clinical trial, we have to chemically synthesize the molecule. We have to do analytical testing in a lab. We have to do preclinical testing with mostly rodents and other animals. Then we have to test in humans. And every one of those sites, every one of those facilities has to be licensed by the DEA or equivalent. And so, yeah, that adds a ton of cost and a ton of time. So there are lots of hurdles, but we're pretty much there. We just filed an IND with the FDA to start a human study this summer. That'll be in patients with depression. We hope that by the end of the year, we'll have some initial data. And then we have another study, a phase 1 study that we're running in the Netherlands using DMT, which is a very, very short-acting psychedelic, and in that study we're testing in smokers to try and learn more about the dosing dynamics as well. So yeah, there are a lot of hoops to jump through, but that's what makes drug development so expensive.
I feel like the speed in which the psychedelic industry has gone, I feel like the cannabis space has really kind of helped open it up for people, right? I mean, do you think that's accurate? Because, you know, you hear guys obviously like Joe Rogan, talking about it, who's got a massive following, and others, but it seems like the speed in which, I mean, look, your company since only 2019, and you're the first one to be publicly traded. Do you feel like the cannabis space has kind of helped open doors or make things kind of break down the regulatory framework to let you kind of do your thing?
It hasn't changed the regulatory framework, but it has changed people's mindsets. So I think that, this wider acceptance of cannabis has led people to think, well, maybe there are other drugs that we thought were bad that could help us. And I think psychedelics fall into that category. Psychedelics are Schedule 1, not because they're dangerous. They're Schedule 1 because of political war on drugs in the 70s. The safety data just doesn't warrant them being scheduled, but they are. So I think the pandemic and an awareness of mental illness and this changing attitude to cannabis has just led people to think, well, why not try something else? Because pretty much nothing else we have for depression today really works very effectively for most people.
You talked earlier about, you had mentioned, how you've essentially taken what was natural from a mushroom and then made it synthetic. I built my entire business on selling natural health and wellness products. And to be honest with you, we've been kind of like anti anything synthetic, right? But I always, at the same time, depending on which side of the table I'm making the argument, everything that's synthetic had to have derived from something natural anyway, right? So what are your thoughts on the people that are out there that are, you hear about these retreats where they're micro dosing, again, I had mentioned ayahuasca. Are these people going down a dangerous path, and could they even potentially kind of stall what you're doing or even hurt the space in which you're in right now? Because there's just a lot of, I wouldn't call them charlatans, but there's just a lot of people out there that are truly just experimenting because it is somewhat more in the public consciousness.
It is a bit of a risk to us in that when you think back to the 60s and 70s, and the war on drugs occurred because of Timothy Leary and all of that sort of misinformation and experimenting around psychedelics. And so there is something.
Are you guys going to have a magic bus?
we should do that. We should do that.
Yeah.
But look, I mean, there is a risk that there were some bad experiences that have come from that kind of use, and that helps to keep this stigma and misinformation around psychedelics. We're trying to make these treatments available to as many people as possible because there are so many people that are in need, and we think the best way to do that is to get the cost of these treatments reimbursed by your health plan or by a government around the world, because that's the greatest chance I think we have to massively improve patient access. But to get these approved as pharmaceuticals so they can get reimbursed, we have to go through all the clinical studies, prove safety, prove efficacy, and the purity of these synthetic molecules so they're consistent over time. So we just have to jump through a bunch of hoops. And I think it's the safest pathway to sort of mass adoption.
Yeah, that makes sense. In a second, I want to talk to you a little bit about how the research that's out there that not only incorporates, maybe taking, a psilocybin compound, so to speak, also with psychotherapy and the importance there in just a second. Folks, again, if you've been listening, if you've heard me talk about this, you've heard me talk about happiness. My company is called Wicked Happy for a reason, because I said I wasn't happy. And there are so many people on this planet that aren't happy, that are looking for happiness, that are looking for a way to just, live their lives in the way in which they should. And a lot of them are going down the path of self-medicating and street drugs and just living a life of just misery. There are answers out there. There are things that are happening right now. And Doug Drysdale is really on the forefront of that. If you're interested in what his company is doing, you can just go to Cybin.com, CYBIN.com. They're actually publicly traded on the New York Stock Exchange. They're a relatively new company within this world, only a few years old. They've raised over $120 million. They have some huge partners, and they're really kind of leading the way and helping people with things like depression, anxiety, addiction, all the things that we're all struggling with. And they're looking at, truly, it started with that little magic mushroom, and they're taking it and putting it into a more standardized compound so that when you do take it, it is going to be consistent with you. So it actually is safer. And again, you've heard me talk about synthetic versus natural. There are certain things that are just, I think, way, way too far as far as synthetic, but this is not one of them. So again, if you want some more information, go to cybin.com. So, psychotherapy, right? I've been open about me, I've been going to a therapist since I was a kid, and it's been on and off. And I think it's so important. I think it's psychotherapy with my therapist. I'll have to ask him what it is. I am also a practitioner of transcendental meditation. What are your thoughts on these, talk therapy in conjunction with your study? So the research that I guess you're going to be conducting and some of the research that is out there combines these two. Some do, some don't. But what are your thoughts on, like when you go into actual clinical trials, is it just going to be double-blind, placebo-controlled? Take a, put it. I think it's sublingual, and psychotherapy, or is it both? Or tell me a little bit about the importance of that.
Yeah, when you do a meta-analysis of every academic study on psychedelics, and there are dozens and dozens of these studies, and what doesn't matter what the molecule is, it's clear that when patients have good psychological support and preparation at the beginning, before they take their treatment, the outcomes are just better. They're much more impressive. So we're combining that psychological support in our studies. These can be quite traumatic experiences for patients. Depressed patients aren't having a fun trip. They're not going out there looking at rainbows and unicorns. They're dealing with the trauma, the underlying trauma that's maybe caused their depression or caused their addiction. So these can be traumatic experiences for people, but they lead to essentially what we're seeing in many cases, almost a cure for depression. So it's really important to make sure that patients are psychologically prepared for what they're about to experience, and that leads to better outcomes overall.
As I'm thinking about the growth of your company, and I think about, say, I own a CBD company, and I remember when that started, and for me, I was really interested in, again, the happiness molecule, right, and how CBD kind of helped unlock that a little bit. But I also thought about from a regulatory framework, CBD is in a weird space, right? But then I was thinking even like the advertising side of it. I know you guys have an Instagram account. It's at Cybin Inc. Do you guys advertise your business to the general public? Is there any point in doing that right now, or even just advertising in general? Are you out there, kind of trying to educate people through advertising? And if so, have you experienced any sort of pushback from, some of these media companies that for some reason or another are really kind of hesitant to get involved in some of this stuff?
It takes some education. We've had some of that pushback from some outlets. We had some of that pushback from the New York Stock Exchange until they got comfortable and understood what we were doing. So we're not necessarily advertising per se, but we are trying to raise awareness. We are trying to educate. And part of that also comes along with our partnership with the Chopra Foundation. So the Chopra Foundation, headed by Deepak Chopra, that everyone knows, they spend all their time trying to help people, help the public overcome the stigma of mental health. Well, there's a similar stigma around psychedelics because of the war on drugs. So it's a great alignment, and we're doing what we can to get out to the general public, to key opinion leaders, influencers, to try to help people understand that these aren't dangerous drugs. They're not addictive, and they can really help people overcome these mental health conditions.
Yeah, I mean, to be aligned with someone like Deepak Chopra, and he also, I think he did that documentary about, I think it was actually called Weed, right? Didn't he do that? Or I think it was like a 4-part series. I'm pretty sure it was him. Yeah, it definitely was, about kind of like dispelling the myths of marijuana and its benefits. If you could, you're in Mass as well, and so you'd appreciate this. You're wicked smart, as we would say here from Massachusetts. If you could maybe give us talk to me and the audience. I hate that the audience members are probably smarter than me. Like we're in, grade school, about the method of action. In other words, someone were to take your product or one of them. I've watched some of your stuff. I think it's sublingual, so it goes under the tongue, absorbs in the bloodstream. What is the kind of the method of action? Like, what's actually happening in people's brains that either makes them feel better? Is it a short-term thing? Is it a long-term thing? What's really happening?
Okay, so psilocybin and DMT, structurally, these molecules are very, very similar to serotonin. So serotonin is a natural neurotransmitter in our brains that makes us feel better. So when we deliver these molecules into the brain, they're hitting those serotonin receptors and having a significant effect. And there's lots of different serotonin receptors. These are hitting the 2A receptors, and this agonism of the 2A receptors causes the psychedelic effect. And that's what we feel, that's what we see, and helps us be introspective during these sessions. What we see under fMRI, so imaging, neuroimaging, is we can see during a psychedelic session, new networks and new connections being formed, literally new neurons being formed. So neurogenesis is happening in real time. And it seems that this combination of networks and connections enables parts of the brain to speak to each other that don't usually do so. We get locked into habits. The human brain is designed to form habits. They help us not have to rethink something every time we do it, for like it's the first time, and it protects us. It's a form of safety. But what happens is when you get into negative thoughts, is that we just keep playing those negative thoughts over and over, ruminating, and it's a negative habit that we do, and that's a lot of people just spiral round and round, just going over and over these thoughts, and it makes their depression worse. Well, by creating new networks and new connections, we can get rid of those dangerous thought patterns and help people rethink their traumas that they went through. And so you see from just 1 or 2 doses in a large number of academic studies that patients can be completely free from depression or addiction for 5 or 6 months at a time, potentially, from just 1 or 2 doses. So this is a rapid effect, happens with pretty much the same day, and can last for 5 or 6 months. And that the current treatments just don't do that. SSRIs like Prozac and Lexapro for depression take many, many weeks to work, and they don't work for everyone. They maybe work on about a third of patients after taking them for 3 or 4 months, and maybe 2/3 of patients after a year. So they're really slow, and they don't work for everyone. Psychedelics appear to work in about 70% of people. They work very rapidly, and they can give benefits that last 5 or 6 months at a time from just a couple of doses. So it's a massive paradigm shift in how we think about treating mental illness.
I mean, that's insane to me to hear the efficacy of that. As far, I mean, when I think there's a lot of distrust in the United States about efficacy recently, obviously with vaccines and stuff. But when you hear a number like that, as far as, being efficacious, meaning, again, whether or not it works for people, 70% is a massive number, right? I mean, in anything, like, people think, again, I don't want to get into a vaccine debate or anything like that, but, you hear, oh, it's, 90% effective, and it's usually not, because it's like a subcategory within a subcategory within a subcategory within a very specific type of ailment. You're saying most of the research, it's 70% of every human being that have taken it, some studies, not all studies, roughly, that, 70% of the people, it's been effective. Is that accurate, or am I overstating?
No, that's right. So there's one study I can quote you that was published in November of 2020, so pretty recent, by a team at Johns Hopkins. So really, got a great reputation. And they found that in patients with depression, 71% of them had a statistically significant reduction in the depressive symptoms. Right, that's the caveat. After 4 weeks after treatment, and 54% of them were in remission, which means they could not be classified as being depressed anymore. So those are massive numbers. And if we can translate this fairly small study, it was like 24 patients, but if we can translate that into larger clinical studies, which is what Cybin is trying to do, then we really have an opportunity to get away from this chronic dosing every day with SSRIs that some people describe as chemical handcuffs. It may help with the signs and symptoms of their depression, but also often they can't feel joy. The real difference with psychedelics is that they help patients tackle the underlying trauma and get to the root of the depression, rather than just putting a Band-Aid on it and masking the symptoms.
Now, I know you've partnered with some facilities here in the United States. I think it's like, I don't know, 150 of them or something that work with people as it relates to depression and mental illness. When you're beginning to go into human trials, how do you find the people? I mean, it sounds like to me like the people would be lining up, like, just sign me up, like I'm ready. Like, how do you find the people? What's that process like? And have you even started that yet?
Yeah, so you're right. People are lining up. There's one study that we're sponsoring in Seattle, the University of Washington, in healthcare workers. So we wanted to partner up with that hospital and help the healthcare workers that are facing burnout and depression from dealing with COVID for the last several years. We wanted to study psilocybin in 30 subjects, 30 patients, and we had 1,000 people sign up for the study. It's just tremendous. But it's also sad, obviously, that there's this massive need. This upcoming study that we're planning to be running in New Jersey. It'll be run out of a clinical unit, and that clinical unit sees depressed patients all the time. So we'll screen those patients to make sure they're suitable for the study. But it's generally a reach out through physicians and psychologists, psychiatrists, and sometimes we need to advertise. But in this circumstance, I don't think that's going to be necessary at all.
I mean, it truly sounds, again, as someone who, I don't know that I've ever really probably clinically been depressed. I would definitely say that I've definitely had seasonal affective disorder. I think a lot of people do in New England. I think you're on the Cape, the winters here can get pretty brutal, especially for you on the Cape, because it can be pretty desolate out there. But when I think about really what it's like, again, I've had panic attacks before, and it's absolutely crippling, and you don't know what to do. And then you think to yourself, you'd mentioned earlier, your thoughts, it just gets worse and worse and worse. And then, it stays with you sometimes for weeks, that feeling of, just hopelessness, for people. When I'm listening to you speak and understanding for the most part of what you're saying, I'm like, how do we get this now? Like, well, how do we get this today? Like, so, I mean, I also understand what it takes to, like you mentioned earlier, to get a drug approved and to get it out there. And what's your time frame really looking like? I mean, I know there's a lot of hurdles you got to jump through, assuming that everything goes the way you'd want it to, safety, efficacy, the whole thing from today. So it's 20, we're in 2022 still, right? 2022. Company started in 2019. Like, what's a realistic time frame from today to actually having hopefully a drug on the market?
Yeah, it does take a long time. We have to go through these studies in multiple studies and hundreds of patients to show safety and efficacy. If we want to help people, we also the first rule of medicine is do no harm, right? So we're going to make sure they're safe. We're 3 or 4 years away, likely from these being commercially available. But what's amazing
it drives me crazy, man, because like knowing what you're talking about, it's there are so many people, now because of COVID, right? It's becoming more acceptable to talk about, people's mental challenges, and it's not. It's still going to be a stigma, and for whatever reason, but man, you must be like every day you just can't. Like, I would be so patience is not my thing, man. I don't know, like every day you just like trying to like speed it up a little bit as best you can.
We are, and look, it is a glacially slow drug development, but for good reason, right? We don't want to miss anything. But what I will say is really exciting is that the FDA has granted breakthrough therapy status to psilocybin, which means they're saying that they believe there's huge potential in the molecule, and that process, the breakthrough therapy status, will speed up the process. In the UK, the MHRA there, which is the FDA equivalent, has granted fast track status. So there are programs like that will help us go a bit faster. There are special access programs and compassionate use programs that we can tap into in different countries around the world as well to get patients into studies faster and to help people that are in desperate need. When you have so many 900 million people around the world impacted by some form of depression, anxiety disorders, or eating disorders, then we've just got to move as fast as we can. And I do think the regulators are actually stepping up in this case and acknowledging that they need to move quickly.
Man, I have so many more questions for you. Hopefully you're going to be able to stick around for a little bit. Again, we're on with Doug Drysdale. He's the CEO of a company called Cybin, really kind of leading the way as it relates to psychedelics in helping you with not all of your, I don't want to sound like it's like a panacea effect, but really kind of helping you with depression, anxiety, even some forms of addiction. So if you're interested, man, I just wish I wish it was available now. But look, if you're interested, if you have somebody that's struggling, if you're struggling yourself, you just want to kind of stay on top of this and see where they're at, go to Cybin.com, CYBIN.com. They're also publicly traded on the New York Stock Exchange. It means anybody can just buy buy shares of it. I mean, look, public disclosure, I actually just bought a little before we went on the podcast. I was like, man, these guys are doing some cool stuff. I feel like it's a really good deal right now, your current stock price. So again, if you'd like some more information, go to CYBIN.com.
Today's episode is brought to you in part by Wicked Happy. The way you live your life depends on your outlook, and theirs is simple. Be wicked happy. Wicked Happy provides you with apparel to make you smile. So if you want to be wicked happy and you want to look wicked cool, then visit wickedhappy.com, and at checkout, enter in the code RADIO for an additional 15% off your entire order. Again, visit wickedhappy.com, apparel to make you smile.
I mentioned the UK. Are there other companies, competitors, that are out there now that are maybe ahead of you, or are there other countries where, I don't even know, are there other countries where this is totally legal and there are drugs that are already working?
So there are opportunities in, say, Jamaica and Costa Rica and other places where you could go to a retreat and have these experiences. In every case with naturally occurring mushrooms, and that's great. I hope people that can do that get the help. Unfortunately, not everyone can afford to do that, and so that's why we're working towards getting these approved as medicines that could be reimbursed for people. We have a few other companies in the space as well. There's a nonprofit called MAPS. They're developing MDMA for PTSD. They've seen some tremendous success in helping veterans with PTSD and several doses of MDMA, which is incredible when you consider just how intractable PTSD is. It's just very, very, very difficult to treat. And another company called Compass Pathways that's working with psilocybin, whereas we're working with a modified version of it. As I mentioned, psilocybin has a 4 to 6 hour treatment session and takes maybe an hour to an hour and a half to get to peak effect. And we think that's very long and difficult to sort of scale within the health system. So our psilocybin analog, which is called CYB3, is twice as fast in terms of onset and half the duration as well, and far less variable, so more predictable. So we think that that's a better, this is an ideal situation where you're taking something that's naturally occurring and tweaking it slightly to improve it, make it more like a therapeutic. And we think that would be much more scalable and then therefore more reimbursable for these clinics that I think are beginning to grow around the country.
We're talking about, things that are affecting our brain, our thoughts, anxiety, depression, addiction. I think it might be early for your company, but I just don't know. Didn't have a chance to really look at all the science out there. But a lot of times the underlying depression or anxiety is a result of or an effect caused by some sort of other physical aspect of humans, like pain, right? So is there any research out there, or are you looking into psilocybin as it relates to helping people with pain? I don't even know, because I know when I think about THC and the different compounds within cannabis, there's just tons of stuff out there as it relates to pain. Are you finding, is there similar stuff like that with psilocybin type products?
There's a small amount of data that in pain, so it could be beneficial. These molecules are also anti-inflammatory. So they might help with neuroinflammation. So that could be Parkinson's, Alzheimer's, MS, for example, in maybe lower doses. But you're right. I mean, pain gets people depressed. Depression makes pain worse. It's a vicious cycle. In fact, depression makes everything worse. I mean, a lot of people that are depressed have other diseases, high blood pressure, heart disease, and depression makes every other comorbidity more severe and also worsens mortality as well. So if we can help people, alleviate their depression, it's going to help the rest of their health as well, and save the health system a huge amount of money in those additional costs.
A lot of times when you're looking at the protocols for a clinical trial, double-blind, placebo-controlled clinical trial. There sometimes there's a physical manifestation, for lack of a better term. Something physically happens to the person, right? And so, like, if it's high blood pressure, their blood pressure goes down. If it's high cholesterol, then you can just tell that their cholesterol goes down. With this type of product we're talking about, you're really talking about something that is how, I guess my question is, how are you measuring it? Because there's a lot of times there are existing protocols as well in research for someone who takes the product, and then then they respond basically almost like a survey. But how are you proving the efficacy, I guess, also as a part of the question?
Yeah, that's a very good question, because generally we use quite qualitative measures rather than quantitative ones. And there are a couple of really well established depression scales, HAM-D and MADRS, they're called, they're acronyms. And we've been using them since the 50s, so they're very well established, and they're pretty good. I mean, they're not perfect, but they're pretty good. And so we'll be using those because they are well established and they're recognized by regulators like the FDA. So that's really important. But there are some other things we can do as well. So we have a partnership with a company called Kernel, based out in LA, and they've developed this incredible neuroimaging device. It's using 30-year-old technology. So it's really well established technology, understood, but they've miniaturized it about 100,000 times. So instead of being a massive room full of technology, it's the size of like a bicycle helmet that goes on your head. And they can use this, it's called functional near infrared spectroscopy. They can use this technology to shine photons into the brain, and then they measure the scatter that comes back, and you can see images of what's happening in the brain. And we're running a study right now where we're looking at before, during, and after a psychedelic treatment, what is going on. And we had one subject come out of it so far, and we can clearly see neuronal changes that are happening during the session. And then we measured the subject for 5 days after, and every day you could gradually see the effects still there, but fading away. Then this was using ketamine, which is quite short acting. So we think that in the future, with some of our treatments, we might be able to use this kind of imaging to predict how long the treatment might work, whether it's 3 months, 4 months, 5 months, and maybe use it as a signal to tell the patient that it's time to come back for another treatment before they start to get their depressive symptoms kicking back in. So technology is evolving. The brain is kind of the last part of our body that we really are looking at with technology on a regular basis, because the technology has been so expensive and so large, like fMRI machines, right? But now it's becoming more miniature and more wearable. We're going to start to see a lot more quantitative data and neuroimaging that's going to help us understand how these drugs work and how long they work for.
Man, it's really awesome. What you're doing. If you don't mind, in a second, I want to talk to you about, kind of the business side of things. I think I'm really interested in how does one go about raising, over 100 million? What's the IP like, intellectual property, patents, trademarks, copyrights, things like that. That's important to a company like yours. We'll talk about that in just a moment. Again, we're on with Doug Drysdale and his company called Cybin. They're one of the leaders. First of all, they're the first publicly traded company on the New York Stock Exchange that is working towards helping people with their health and wellness, obviously mentally, using psilocybin-based ingredients. If you'd like some more information, go to cybin.com, cybin.com. Again, they're publicly traded. You can check them out on pretty much every app that's available. If you're interested in investing in them as well, you certainly could. And again, just a little caveat, I don't even know if I'm supposed to or not, but I did just buy some. I have no idea from what I'm supposed to say, but anyway, as a lawyer, I don't have a lot of patent experience, but mostly trademarks, copyrights, and things like that. My companies that we didn't really have anything to patent, but talk about the importance of patent, because when I think of, again, because I have a CBD line, I think about what happened in the CBD space, where, the first drug that, the first one that came to market was an actual drug. And then, everybody's freaking out about it. I understand why there's an issue, right? Because it'd have a severe chilling effect if they just reversed it. So, but talk about the importance of patents, within your industry, and why, you spend so much money, protecting it.
Yeah, patents are really important. As you mentioned, we've raised $120 million so far, and we'll need to raise more during this process. We've got multiple drug programs that we're developing. And for investors coming into the company, they want to see a return. And there's no way to get a return unless you can protect your intellectual property. And so patents are important. We've filed 19, I think, patents at this point across 3 different patent families. We've had one issued so far that is composition of matter, which is the strongest type of patent you can get. This is for our CYB004 program, which is a modified version of DMT, plus a number of other molecules as well. So as I mentioned at the outset, we're taking these classical molecules that are naturally occurring and taking all the benefits of them, but modifying them slightly to overcome some of the downsides, the long-acting nature or the variability, the unpredictability. And by making those modifications, these are innovative changes that really will help patients and will help them become therapeutics. And so those changes can be protected using patents, intellectual property. But also, as we learn more about the properties of them, how they operate in the body, how they enter the brain, how they interact with food, dosing regimens, and other methods of use. So, and the whole number, about 1,000 or so claims probably in those patents that are going through the prosecution process. But that gives, I think, our investors confidence that we're protecting the work that we're doing, and we'll be able to get a good ROI on these assets as they come to market.
As someone who's never really raised any money before, all of my businesses have pretty much been bootstrapped and, the classic, closing out the 401k and, maybe borrowing some money from friends and relatives. The process of raising, 120 million is nothing to shake a stick at. I mean, it's a decent amount of money, but when I think about your business and for the next, so you have no revenue, right? So, what's that like? Because to me, it's just foreign, like if I'm not bringing in revenue, I'm dying, does that get you at all? Do you think about that? Like okay, well, in order for us to have, a longer runway, so to speak, we have to raise more money. And like, I don't know, I for some reason, it just doesn't sit with me, but this is what all the big companies do. But do you think about that? Like, hey, we got to be profitable, like within the next couple of years.
Yeah, but there's a well-established sort of model in biotech for creating value. So when we went public in November of 2020, we raised capital from about a half a dozen really large US biotech funds. And these guys manage billions and billions of dollars, and they're very, very smart. They do the due diligence. They know the science. And so they're investing in something that is quite robust. And given there's a lot of this academic data out there already, we're fortunate in that our drug programs are somewhat de-risked because there's already human data out there. So that's a great starting point. But if you look at most biotech companies, there's a real inflection point in value creation, and that is when you get to phase 2. And phase 2 is when you start to get patient efficacy data. And right at phase 2 is when valuations literally for biotech companies literally start to become just going up. I've lost the word, but going up dramatically. And not just incremental changes, but massive step-by-step changes. So our job is to raise capital, is to spend it wisely on drug development, make sure we're hitting those value-creating milestones along the way. And as we get through phase 1, phase 2, phase 3, value of the company increases, and we can return, good returns to our shareholders.
When I think about, thank you for that, by the way, you educated me, so now I get it. So when I think about, I mentioned earlier, advertising, I'm a marketer. It's, kind of like what we've been doing for the past 20 years. We're great at marketing things. And, when I had heard that, Tony Robbins was an investor and mentioned your company in his book, man, that must have been a big moment for you. How did that happen? Did someone tell you, hey, by the way, you're in this book with this huge influential guy who's really trying to help people's happiness and live just the life that they should live? Like, well, how did that happen? And have you talked to him? Does he want to come on the board? Like what happened there?
Sometimes you can spend a lot of money trying to do things, and sometimes things just work serendipitously. And Tony's new book, Life Force, he covers a whole range of really innovative medicines like stem cells and gene therapy, things that are cutting edge and going to help with these massive diseases and also longevity as well. And I just found out serendipitously that we were mentioned in the book, our psilocybin analog program. So really flattering. And then even more flattering from the book, Tony says that he was an early investor in Cybin, and I had no idea. So I guess we're getting the right message out there. Someone like Tony who must see literally thousands of investing opportunities and sees a lot of science-based stuff. Clearly, he's able to write a book about it. Hugely flattering. So it just gives me confidence we're doing all the right things.
So now that you know this, has anyone from your team reached out? Have you guys had conversations? Because, look, I mean, he's invested in some pretty big companies. I believe he bought Twin Labs back in the day. So he's definitely, I've seen him, do stuff in like hyperbaric chambers and cryotherapy. I mean, he's definitely on the cutting edge of that stuff, trying to remain healthy himself. And he's a big human being. So inflammation, I'm sure, isn't. But has anyone, reached out? Are you guys having conversations or?
Yeah, our teams are definitely in contact. They've been in contact. It's obviously not a surprise, and maybe we'll end up doing some event at some point with Tony. That'd be great. That'd be amazing.
So listen, again, I want to thank you so much for spending time here. Any last thoughts for people listening right now, people that are struggling, people that might be interested in investing? Any last thoughts about, what you guys are doing, for humankind?
Yeah, like I'd say for people that are suffering, these treatments are coming. They're a few years away, but they are coming. So just keep an eye on the media. Media is getting a lot of media attention right now. So keep following and watching, and obviously follow us at Cybin.com. You'll be able to follow our progress. But yeah, I'm very excited about the rest of this year. We've got 4 human studies that we're sponsoring this year. We'll have data from at least 2 of those, maybe all of them, by the end of the year, that will help bring the programs forward. And each one of these stages is great for the programs. It's great for progressing these treatments closer to market. And we're a public company. It's also great for our investors as well.
Doug, again, thanks so much for spending your time with us. It's really interesting what you're doing. It makes me happy knowing that there's companies out there that are really trying to help others. Because we all need the help, and there are things that are out there that ultimately did drive from a natural source as well. Again, if you'd like some more information about Doug Drysdale and his company Cybin, go to Cybin.com, Cybin.com. You can also check him out on Instagram. It's at Cybin Inc. Listen, we bring people on this podcast that are doing real things, that are making a real impact on the world. And it's really, it really makes me feel good knowing that there are companies like Cybin, there are guys like, Doug and his team that are really working towards making this just a better place, because it is a beautiful thing to be a human being on this planet, and we all want to be happy. And if there are other ways that are more natural, that are more effective, that are safer for you than some of the alternatives that people are looking towards, make sure you check out Cybin and what they're doing. Again, it's Cybin.com. My name is Mike Alden. That's Doug Drysdale, and we'll see you soon.
Today's episode is brought to you in part by Wicked Happy. The way you live your life depends on your outlook, and theirs is simple. Be wicked happy. Wicked Happy provides you with apparel to make you smile. So if you want to be wicked happy and you want to look wicked cool, then visit wickedhappy.com, and at checkout, enter in the code RADIO for an additional 15% off your entire order. Again, visit wickedhappy.com, apparel to make you smile.